Hi, I'm Dr. Todd Shatkin, and today I'm here to talk to you about the differences between conventional implants and mini implants and various options that are available to you when you're considering tooth replacement. Patients have been suffering from loose dentures for decades. They move around, they're uncomfortable, they gag you. You have to use a lot of denture glue and adhesives to hold them in place, and oftentimes they slip in very uncomfortable situations. For example, if you're out to dinner with your friends or your relatives and you're having dinner and the dentures slip around or even fall out of your mouth, it can be very embarrassing. It could also be equally embarrassing when one of your grandchildren run up to you to jump in your arms and your teeth fall on the floor. These are the kind of stories I've heard for years from my patients who suffer from loose, ill-fitting dentures or uncomfortable dentures. I want to talk to you about different options that you have for replacing those missing teeth with either removable or permanent dentures that snap onto implants, or can be screwed onto implants or cemented onto implants. So I urge you all to do your research and really understand the different options available to you. So let's start out with the simplest option. Loose, uncomfortable dentures can have either 2 or 4 conventional implants placed, and a denture can be made on top of those. What's required with conventional implants is, and these are what I call standard diameter implants or conventional implants, you place an incision in the gum typically, you place these implants into the bone, and you bury them in the bone for about 4 to 6 months. At a second surgery, you'll come back to the doctor's office and have those implants uncovered at about the 4 to 6 month time period. And after they're uncovered, then an abutment is placed on top of those implants, at which time a restoration can be formed to go over the top of those implants, whether it's a removable or a permanent restoration. This all takes about 6 months to a year to complete the process. Other options out there are to stick with your regular dentures or have new dentures made that perhaps might fit a little bit better than your existing conventional dentures, or you could have your existing dentures relined to fit a little bit better that way. Another option is to have what we call mini dental implants. I like to say mini implants are 5 times less. They're less invasive, they're less painful, there's less healing time, less visits to the dentist, and most importantly, less costly. The average cost of conventional implants, what we call an all-on-4, all-on-6, or all-on-X, it could be any number of implants with conventional implants, the average cost is anywhere from $20,000 to $40,000 per arch. So to do your whole mouth, it ranges from $40,000 to $60,000 or even $80,000 to reconstruct an entire mouth with conventional implants. The mini dental implants, to either stabilize loose dentures or replace the missing teeth permanently with cemented restorations or detachable restorations, ranges from $20,000 to $40,000 for the entire mouth. So they're quite a bit less, in many cases about half the cost of conventional implants. It's important for you to understand everything involved with both options. Like I said before, conventional implants will take, on average, 6 months to a year to complete the process. The small diameter or mini dental implants that we perform will take anywhere from 1 to 3 months to complete the process. In most cases, it's finished in 5 or 6 weeks. And that would even include having your teeth pulled if you need to have your teeth taken out. With conventional implants, you'd have to extract the teeth, wear temporary dentures for a period of time, and then have another surgery to place the implants, and then additional visits to restore those implants after the 5 to 6 month healing period. With the mini implants that we perform, we are able to take the teeth out, place the implants the same day, and put at least temporary bridges in so you never leave the office without teeth. On the other hand, you'd have temporary dentures placed or even permanent dentures placed at the same visit as the extractions. But again, you'll never leave the office without teeth. You'll always have teeth in your mouth, and that's very important. With the mini implants, we have several different options for replacing the teeth. So I want to start out with the simplest option, which is the option of a snap-on denture. This is an example of an upper denture with 6 mini dental implants to stabilize the loose denture. It snaps right in. And the advantage here is we're able to take the palate completely out of your denture. So you no longer have to have that plastic on the roof of the mouth, which inhibits tasting hot and cold foods, inhibits your speech, and can be causing gag reflex. By taking out that palate, our patients are able to eat better, speak better, and they don't have to worry about gagging. They would take this denture out 2 or 3 times a day to clean their teeth, clean their implants, and clean the denture. And they can put it back in, and we recommend they keep it in during their sleeping hours. We do the same type of a procedure for the lower jaw, where we place 4 mini implants in the bottom denture, and the denture snaps on the same as the upper. Inside the denture are these rubber O-rings that snap onto the O-balls on the mini implants. Now this can be done with conventional implants as well. The only thing is, typically with conventionals we only use 2 conventional implants, and because of that the denture tends to rock back and forth. By placing 4 anchors, we're able to get a more stable restoration. Now, let's talk about the next option with implants. The next option is either a detachable or a cemented roundhouse restoration. So let's talk about the detachable roundhouse restoration first. This is a porcelain restoration with no plastic at all, and we use anywhere from 6 to 10 implants to stabilize this type of a detachable roundhouse, and that also gets snapped on, but we don't have the patients take this out. This gets removed at the dental office 2 or 3 times a year when they come in for their dental cleanings. And when they come in for the cleaning, the dentist or the dental professional will remove the restoration, check the implants, clean the implants and clean the restoration, and then replace the restoration until they come back for their next cleaning, which would be anywhere from 4 to 6 months later. This is an excellent option because we have the ability to take it out and clean it professionally every 4 to 6 months. In the meantime, our patients will use an electric toothbrush and a water pick that we will provide to them to keep it clean. And that's something that we give to our patients as a courtesy so they can do a really great job at home of keeping everything nice and clean. Now the next option is the cemented roundhouse restoration, which can be done on mini implants or on larger implants. So let me show you the mini implant roundhouse option. The roundhouse cemented option typically has anywhere from 10 to 12 mini implants placed, and that gives us an anchor for almost every tooth in the mouth, which makes it very, very strong. We then cement that restoration in place, and it looks like it's coming right out of the gum tissue. And it's a beautiful restoration which feels very similar to having your own teeth. And this is the most similar option of having your own teeth. And this again can be done with small implants or the mini implants, and also larger conventional implants. But typically with the conventional implants, the surgeon will place 4 to 6 implants in the arch. I did those surgeries for decades. My father and I, from the 1980s and 1990s, always did conventional implants because the mini implants were not around until around the year 2000. So we did those larger conventional implants. The trouble with them is it requires a lot of invasive surgery. Oftentimes, a sinus lift surgery has to be performed first if the patient doesn't have enough bone in the maxillary jaw to support the implants, or ridge augmentation with bone grafting would be done if the patient doesn't have enough of a wide enough ridge for the conventional implants. And that causes even longer healing times and a more invasive surgery requiring many follow-up visits. And this could take 1 to 2 years to complete if you have to do these bone grafting and sinus surgeries to get this patient ready for the conventional implant surgery. There's nothing wrong with that procedure. It's a very good procedure. It just takes a lot longer and it's more costly, and there's definitely more discomfort involved with these more invasive surgeries. Like I said, I did these surgeries for many, many years, and we had very good results. It just takes a lot of time and a lot of cost to the patient and many, many office visits and surgical procedures. Sometimes we can use larger implants like these here to support a full arch of teeth. And in this case, there's 8 larger implants supporting a cemented roundhouse restoration. This is also an option. I just feel like 4 conventional implants is not ideal, because if you lose 1 implant out of 4, then you really don't have anything to use, because you can't do a roundhouse bridge on 3 implants. And oftentimes 1 or more implants can fail. Implants are not 100% successful. We have approximately 90 to 95% success with implant dentistry of each individual implant. So if you have 4 implants and all are successful, you can build a bridge on it. But if 1 doesn't work out, then you're stuck back to square one and figuring out a solution. So I really like the idea of having at least 6 to 8 implants in place, even if you're doing conventional implants. And if you're doing the smaller implants, I like to have 10 to 12. And we have really, really great success with these. I've been doing these roundhouse restorations on both mini and larger implants for the vast majority of my 35-year career. And we have well over 90% success rates with these. So let me show you now the mini implant option for cemented restoration again. Here's an example of 12 implants with a cemented roundhouse bridge. Now in this case, you'll notice that we have some pink gingival tissue on the bridge work above the teeth. This may be required in certain situations in order to give the patient enough lip support so that they can smile with confidence and have a youthful appearance. Many times when patients have been wearing dentures for many years and they have that extra lip support, they've had a lot of bone loss over the years and their gums recede and shrink, and you need that extra lip support from this extra pink tissue that can be placed on a denture. Conventional implants can also be used for single missing teeth, and so can the smaller or mini implants be used for single missing teeth. Let me show you an example of the use of mini implants for single tooth replacement. In this case, a front tooth is being replaced with a mini implant and a cemented crown. This is an excellent procedure and works very nicely. Again, the mini implant is minimally invasive and can be done in 1 or 2 short visits. Here's an example of a 3-unit restoration being replaced with mini implants. Again, this gets cemented onto the implants. And this again can be done in 1 or 2 short visits. Conventional implants to do single tooth replacement can take anywhere from 3 months to 6 months to complete the process, and typically takes a minimum of 3 or 4 visits. So I recommend you really doing some research and looking into all the options that are available to you before choosing the solution that best fits your needs and your budget. Many years ago, I published this article in a dental journal called Dentistry Today, a mini implant alternative to All-on-4. Thousands of dentists around the country have chosen to perform the mini implant alternative to All-on-4. If you would like more information about mini dental implants or any implant questions you might have, please feel free to contact me at the Aesthetic Associates Center. Number is 716-839-1700. I'm Dr. Todd Shatkin, and thank you for listening to this program.